Regional stay-at-home order is now in effect, which means new restrictions and closures for San Diego businesses.
And, all of this, of course, aiming to help slow the spread of COVID-19, mainly so our hospitals don't get overwhelmed. And County Supervisor Nathan Fletcher is joining us this morning with more details on this new order. Good morning to you, Supervisor.
Good morning to you both.
So let's get right into this. Of course, the new order based on ICU capacity, and San Diego's numbers not as high, or as far as our capacity goes, compared to other places. But why were we grouped with other counties all across Southern California?
Well, our numbers are not good. We're essentially at 19% ICU capacity now. We've had an 8-fold increase in COVID hospitalizations in the last month to 6 weeks, and so we're on a trajectory where we will surpass that 15% threshold in the coming days. But the reason the counties are grouped together is the Emergency Medical Services Act outlines which hospital systems and networks are dependent upon each other for mutual aid. And so that's the network of Southern California counties. But whether we had gone as an individual county or as a group, we would have gotten in the exact same place in just a few days.
Critics out there, including Supervisor Desmond, say that the state hasn't been able to show how businesses like salons or fitness centers cause significant spread. So why are these businesses being targeted, and what do you have to say to the business owners out there who may have to close their doors for good?
Well, the problem with arguments like Supervisor Desmond makes is it ignores that there's a 10-fold increase in cases. We were on a devastating trajectory, and so they go out and say everyone's doing everything right and everything's fine and we just need to tell people to be safe. But that is not a plan that actually changes the direction of where we're going. If everything were going fine right now, then we would not see a 10-fold increase in our daily cases. And we would not be on a path and a trajectory to massively overwhelm our hospital system. And so the simple reality is we have to take action. We have close to a year's worth of information that shows you what the highest risk settings, those indoor settings, are the highest risk. And so when you have community-wide transmission, you have to take unfortunate action. Nobody wants to do the things we're doing, but there's simply not an option to allow it to continue unabated. And when we've taken similar actions in the past, we have seen the curve flatten. We have slowed the spread, and we've been able to preserve the integrity of our healthcare system. So I wish I could go out there and just say, well, if we just ignore it, everything's going to be fine, or attack the governor, or do any of the type of things that score you political points with a group of folks and sow the seeds of dissent and division. But that would not be responsible. And we're elected to make difficult decisions and to face unfortunate truths. And the unfortunate truth is, when you look at the rate of increase of our cases and you look at what is coming for our healthcare system if we don't take action, it compels us to have to do things that may be unpopular, but something we have to do because the outcomes of leaving it unchecked would be exponentially worse.
Right. Now, you mentioned, of course, indoor, the spread increases, but outdoor, so many restaurants, breweries, wineries have these big outdoor setups now, taking over parking lots with their tents and spreading out their tables, doing everything they can. And for many of them, they're asking, why are they the ones being punished now?
Yeah. Well, and we can obviously look. There's some things I would do a little bit different if I were designing it. I think the playgrounds are fine. They're outdoors. Outdoor dining does not cause me as much concern. But I think what the state is reacting to is, again, these astronomical climb in numbers and this overwhelming system, and essentially the mixing of folks when you have community-wide transmission. And so, look, it's hard and it's difficult. No one is in any way suggesting that this is easy, and we certainly all wish we could avoid it. But the state system didn't create the problem we're in. The governor didn't create the problem we're in. A global pandemic, the likes of which we haven't seen for more than 100 years, created it. And so one more time, as we head into the end of the year, look, we've got to come together for at least a 3-week period here, slow the spread. A vaccine is coming. We know that there is hope on the horizon, but we've just got to find a way one more time as a community to fight this thing back.
Yeah, we got that silver lining there. All right. Supervisor Fletcher, always appreciate your time. Thanks for joining us here this morning for the quick chat.
Thank you both.